So our target segments are going to be the, anywhere between T4 and T1. Let's talk about our key performance indicators of how this is going to go successful for us. So we have the table as low as we can. Okay, we're going to have our patient scooch over as far as she can until she actually feels the leg of the provider. All right, then I usually will have some, depending on mobility of the individual, right? So thanks for that. And then so for Mariah, right, you can see that we need a V, not a W, right? So we have a W going on because she's got a lot of mobility. If I thrust through that, it's just going to be her shoulders. So we need to take up some of that tissue slack by having her hug something a little bit more firm. The opposing shoulder is almost always on top. And then I usually will have them lock that in by just giving themselves a big barrel hug. I'll give a further preliminary bump just so the patient knows what to expect. So Mariah's just going to feel like that. Okay. I usually will have an asymmetry within their lower body for a couple of reasons. One, it adds a little bit of obliquity, which adds a little bit more likelihood that I'm going to get more of a gapping as I go through the thrust. Additionally, the opposing limb allows for leverage such that she can help me to roll herself over so that I can get my hand in the right place. Now, my short applicator, I have a couple of options, right? So one is just in this format, where I have the spinous process sitting in the trough between my thenar and hyperthenar eminence. The other one would be here, where I would again have the spinous process like that, and then it's a slightly different nuance, but it's also like this. So so personally, what I've recently had good success with is having a little bit of a little bit more of a buttress within my knuckles, such that this is pretty thick. This can be less thick, and so I just thicken that up with the grasp of the towel, and I will usually use this. All right. So then when we go over, so if we come around, again, so we're going to go for our higher thoracic. So here's our T7 or C7, T1, and then I'm gonna bring my hand in like this, such that I'm gonna supinate, which is as I supinate and roll her over so that her elbows are gonna come high. All right, and then I'm also gonna add a little bit of a side bend and obliquity with that. So it's an extension and then a side bend. So I find my spinous process, make sure that I'm not off to one side. Yep, just like that. And I'm still not quite over. And then Mariah, do you mind just helping me out by pushing through that heel? There we go. Okay, and then as I come over, I side bend. Yep, so she already kind of went. So then I have her in this extension. I like to flex up the neck such that I can still get better leverage. But the biggest mistake that people make is they come like this and then they cram them back down. You want to stay high with that and then thrust through that if you're going to be...
I feel like I'm stabbing you.
Yeah, that's okay. We're gonna come. Again, I'm just we're not going into it just yet. I'm just showing you the nuances
I just
of the
felt
setup.
it digging into your thigh.
It's like I'm being stabbed, but it's okay.
I wasn't aware of it. But yeah, so you can kind of see how if I was to go into it without talking through all of it. So I'd be like this. I come up over. I cradle her like this, lateral flex. And then I'm on it, right? And she can also feel the pressure. And sometimes it's actually good to get feedback at least during your practicing of where they're feeling your pressures. You don't, sometimes if your forearm can kind of come around and they can feel it more on their rib or their costovertebral is what you don't want. You want to get that spinal compression right over your short applicator, hence the reason why I often will flex folks up. All right, and if we were going to go through it, so I'm oftentimes if you're going to go for high, I'm going to do a couple things. So I'm going to bring this up such that it's like kind of in your grill. Yep, and so you're going to turn your head. Great. I'm going to bring shoulders down. I feel good about that. Tables all the way down. I bring in my short applicator. I get a little bit of assistance from my patient with her leg. Refine the spinous process. I come through here, up over extension. I can add in like a secondary vector. Good. Head up. Big breath in. Big breath out. And then thrust.